Interventions to improve oral health in people with mental illness. Oral health is important for overall health and quality of life. People with mental illness are likely to have more tooth decay and more teeth lost compared to the general population. Researchers have tested different interventions to improve oral health condition of this specific risk group. We will look at different scenarios containing interventions that have been tried by different research groups. In these examples, all participants voluntarily agreed to take part in the research. As part of co-production of an effective intervention to improve oral health in people with mental illness, we want to get your views on these interventions. Scenario 1. Dental checklists for monitoring oral health of people in early intervention for psychosis, EIP, outpatient. Mr. M has been receiving community treatment and support from the Early Interventions in Psychosis team. As part of a plan to raise awareness about oral health and keep track of their oral health and dental service use, Mr. M's care coordinator, who is a nursing staff, uses a dental checklist. In this checklist, Mr. M's care coordinator asks him about being registered with and visiting the dentist, owning a toothbrush and brushing his teeth, and whether Mr. M has had any dental problems or treatment. The care coordinator also provided Mr. M with an information sheet with advice on how to promote healthy teeth and gums and details on how to find a local NHS dentist. In order to see whether the checklist made a difference to oral health or dentist visits, Mr. M's care coordinator repeats the checklist a year later. Prior to helping Mr. M, the Early Interventions in Psychosis team, who are mostly nursing staff, has received a training that covered the importance of oral health care in this group, encouragement of awareness of oral care, and aim and procedure of using the checklist. Scenario 2. Educational intervention about oral hygiene on the knowledge of mental health nurses, and oral care intervention to people with severe mental illness by dental hygienists in close collaboration with mental health nurses, both inpatients and outpatients of a mental health organisation. Mr. P is suffering from schizoaffective disorder and is currently receiving treatment on a ward. Mr. P has his teeth checked by an oral hygienist, who then creates an individualized oral treatment plan for Mr. P. Mr. P is given a toothbrush and fluoridated toothpaste, along with a demonstration of how to brush his teeth by the hygienist, who showed images of the toothbrush in different positions in the mouth. He then has the chance to practice his toothbrushing in front of the oral hygienist. Mr. P and his nurse are given a log so that daily mouth care activities can be monitored. Mr. P also receives a brushing instruction card, and nurses are instructed to help him use that card. After 4 weeks, Mr. P has another check of his teeth. Prior to helping Mr. P, ward and outpatient nurses receive a 20-minute teaching session run by oral hygienists using PowerPoint presentation about various oral diseases and adverse effects of certain psychotropic medications on oral health. Oral hygienists also demonstrated cleaning methods and tools such as mouthwash, tongue cleaner, and interdental cleaning aids. Nursing staff's knowledge of oral hygiene before and 5 weeks after the educational session are tested using a knowledge test with a 20 multiple choice items questionnaire. Scenario 3. Dental education, electric toothbrush with instruction to use and reminder system in the Community and Behavioural Health Centre. As part of her treatment for bipolar disorder, Miss B is part of a community support programme. In order to help improve her oral health, she has an oral examination to check the levels of dental plaque, which is a soft, sticky substance that forms on teeth. She is then given some 1-to-1 15 minutes teaching by a senior dental hygiene student about the effects of mental illness on oral health and the importance of oral hygiene using flip charts. In addition, 2 pamphlets are given to Miss B, one describing how medications can affect the mouth, and one giving instructions on how to brush using an electric toothbrush. Miss B is then given an electric toothbrush and a 10-minute instruction session on how to use it. Her brushing technique is then checked to make sure she has understood the instructions. Finally, Miss B is given a plastic box and a specially designed reminder post-it notes with 60 pages. She is asked to pull a paper each time she brushes her teeth and put the paper in the box. A dental hygienist contacts her over the telephone once a week to provide positive feedback and to reinforce the study instructions over the next 4 weeks. A month after she first received the training, Miss B has another check of her tooth. She is also asked to bring in her box of reminder notes of brushing her teeth to monitor. Scenario 4. Oral health education and training on toothbrushing technique and oral health beliefs. Mrs. G has schizophrenia and receives care from Outpatient Department of Psychiatry. As part of a treatment plan to help improve her oral health, she has her teeth examined and thoroughly cleaned by ultrasonic scaling by a trained dentist. She receives some teaching and video demonstration on how to brush teeth effectively. After that, the researchers give her a toothbrush and toothpaste and check her brushing is following the technique. They ask Mrs. G to brush her teeth twice a day and try to help Mrs. G to bring about a change in false beliefs pertaining to dental treatment and maintenance of oral hygiene. During the oral health teaching, Mrs. G's husband is also there to offer support and motivation. Mrs. G and her husband are invited to another visit after a month. At this visit, Mrs. G is asked to demonstrate her toothbrushing technique again, so she can be offered advice. She is also given a personalized handout in the form of a calendar with images, which includes details of oral hygiene practices and negative oral health beliefs. Mrs. G also responds questionnaires on her knowledge, attitude and practice on oral health. Mrs. G is then invited for another dental examination in another month's time.